Good morning, everyone. I am Akshaya GR, lecturer of Emmanuel Arcer College of Pharmacy. Today we are going to see about nasal drug delivery system. Introduction. In ancient times, Indian Ayurvedic system of medicine used nasal route of administration of drug, and the process is called as nasya karma. It has been used for local effects extensively in decongestant and local activity. In recent times, intranasal drug delivery is being considered as a preferred route of drug delivery for systematic bioavailability. Next, we are moving to anatomy and physiology of nose. The nasal cavity runs from nasal vestibule to nasopharynx, which have a depth of approximately 12 to 14 cm. So, the depth of nasal cavity is 12 to 14 cm. Next, the nasal vestibule is a respiratory region and the olfactory region, and are three main regions of nasal cavity. First one is the submucosal zone of the nasal mucosa directly connected to the systematic circulation, thus avoids the first pass metabolism. The lateral walls of nasal cavity includes a folded structure which enlarges the surface area into the nose about 150 cm square. This folded structure includes three terminates: the superior, the median, the inferior. These terminates increase the area of absorption. Nasal cavity is about 60 mm in length. The nasal cavity covered with a mucous membrane which can be divided into olfactory and no olfactory epithelium areas. The no olfactory area include nasal vestibule and respiratory region. First one, nasal blood flow, external and internal carotid arteries, nasal secretion, globulate cells, nasal glands, lacrimal glands. Composition: 95% water, 1 to 2% salt, 2 to 3% mucin. In trace amount of sodium, potassium, calcium, albumin also present. Nasal enzymes: monooxygenase, lactase dehydrogenase, oxidoreductase, phosphates, hydrolases, and esterase, etc. The nasal pH is 5.5 to 6.5 in adults and 5.0 to 6.7 in infants and child. The merits of nasal drug delivery system. Drug degradation is absent. Hepatic first pass metabolism is absent. Rapid drug absorption. Quick onset of time. The bioavailability of larger drug molecules can be included by means of absorption enhancer or other approach. Better nasal availability for smaller drug molecules. Drugs which cannot be absorbed orally can be delivered to systematic circulation through nasal drug delivery system. Convenient route when compared to parenteral and other long-term therapy. Limitations. The absorption enhancers used to improve nasal drug delivery system may have histological toxicity which is not yet clearly established. So, absorption surface area is less when compared to gastrointestinal tract. Once the drug administered, it cannot be removed and it causes nasal irritation also. Next, we can move on to mechanism of absorption. Majority of drugs are absorbed by passive diffusion. Some may be absorbed by active diffusion such as amino acids. Literally shows substitute. 1000 Dalton drugs get easily absorbed without helps of any penetration enhancers. Two mechanisms are found. First one, transcellular process and paracellular process. Transcellular process means transport of lipophilic drugs through cell membrane by active transport or transport through opening of tight junction. Example, levodopa, carbidopa. And paracellular process, it involves aqueous route of transport. It is slowly and passive. Water-soluble drugs which have more molecular weight greater than 1000 Dalton, so poor bioavailability. Pathway of absorption. Drugs, nose cavity, olfactory epithelium, or respiratory. The drugs which reach respiratory epithelium again divided into mucociliary clearance and systematic circulation. Olfactory directly reach the brain. The systematic circulation reach the blood-brain barrier and again then reach the brain. Barriers to nasal absorption. Three barriers: low bioavailability, low membrane transport, enzymatic degradation. Low bioavailability. It is due to the low membrane permeability, low membrane transport, rapid clearance of administration formulation due to MCC. Example, liquid and powder formulation show rapid clearance. Enzymatic degradation. Degradation of proteins and peptides by exopeptidase and endopeptidase. Strategies to improve nasal absorption. Nasal enzyme inhibitors. Example, peptidase, protease, trypsin, apotin, brovalin, Bestatin, brolucin inhibitors. Second one, formulation design. Third, modifying drug structure. Fourth, prodrug approach. And fifth, particular drug delivery. Sixth, absorption enhancer. Delivery systems. First one, nasal drops. Nasal drops are one of the most simplest and convenient system developed for nasal deliveries. Nasal drops deliver the drug to a larger area back in nasal cavity. The main disadvantages of this system is lack of dose prescription. Second one, nasal spray. Both the solution and suspension formulation can be formulated into nasal spray. Due to the availability of metered dose pumps and actuators, the nasal spray can be deliver an exact dose from 25 to 200 micrometer. Choice of pumps and actuator, the particle size and morphology of the drug, viscosity of formulation. Next one, nasal gels. Nasal gels are highly viscous, thickened solution or suspension. Their advantages are the reduction of post-nasal drip due to high viscosity, reduction of taste impact due to reduced swallowing, reduction of leakage of formulation, and reduction of irritation by using emollient. Next one, nasal powder. This dosage form may develop if solution and suspension forms cannot be developed, such as lack of drug stability. Some advantages: absence of preservatives, local application of drug, stability of formulation. Nasal aerosol. Their formulation can be active drug, surfactants, co-solvents, and propellants. Example, budesonide nasal aerosol inhaler. Applications of nasal drug delivery system. First one, delivery of non-peptide pharmaceuticals. Example, progesterone, estradiol, propranolol, nitroglycerin, sodium chromoglycate, etc. Second one, delivery of peptide-based pharmaceuticals, insulin, calcitonin, pituitary hormones, etc. Third one, delivery of diagnostic drugs, secretin for diagnosis of pancreatic disorders, etc. Delivery of drug to brain for the treatment of Parkinson's syndrome and Alzheimer's disease, and for the delivery of MSH and insulin to brain. Fifth one, delivery of vaccine. Nasal mucosa is the first site of contact with inhaled pathogens. Nasal passages are rich in lymphoid tissues. Creation of both mucosal and systematic immune responses. It cannot be injectable. Example, nasal vaccines are prepared for measles, pertussis, meningitis, influenza virus because these pathogens enter the body through nasal mucosa. And nasal delivery of vaccine produce both local and systematic immune response. Conclusion. Nasal route is attractive for the delivery of many drugs and vaccines. The studies are going on improving the efficacy of nasal route. Outcomes of this study, we can utilize it for the treatment of diabetes, osteoporosis, infertility. Nasal drug delivery system offers such benefits as rapid onset of action with lower dosage and minimal side effects. It has advantages of site-specific delivery with improved therapeutic effect, allowing systematic administration without significant degradation. Nasal drug delivery system offers flexibility for multiple formulations ranging from nasal drop to suspension spray. Thank you.